Welcome to the WPS Military and Veterans Health tutorial on TRICARE for Life Skilled Nursing Facility Guidelines for TRICARE providers. A skilled nursing facility provides skilled nursing, rehabilitation, or other care, including medication administration. Skilled nursing facilities are not nursing homes or intermediate facilities. The need for services provided by skilled nursing facilities is common for TRICARE for Life beneficiaries, and there is coverage available for the services. It is important to note the differences between skilled nursing facility care and the services they provide as compared to custodial care, long-term care, and nursing homes. TRICARE for Life does not cover custodial care, long-term care, or nursing homes. Beneficiaries may qualify if they are treated in a hospital for at least 3 consecutive days, not including the day of discharge, and they enter the skilled nursing facility within 30 days of the hospital discharge. There is no day limit as long as the care is medically necessary. To be medically necessary means it is appropriate, reasonable, and adequate for the patient's condition. Prior authorization is not required except for active duty service members and Medicare-eligible beneficiaries after the first 100 days. Covered skilled nursing services include a semi-private room, regular nursing services, meals including special diets, physical, occupational, and speech therapy, drugs provided by the facility, and medical supplies and appliances. Skilled nursing services are covered only in the United States, District of Columbia, and U.S. territories. Assisted living facility care. TRICARE does not cover assisted living facility care or routine personal care associated with assisted living. What is assisted living? Assisted living is a housing arrangement where people can live independently but can find help with tasks and have some services provided for them. These services may include meals, medication administration, personal care, housekeeping, medical services, recreational activities, and more. Coverage. Medicare generally pays 100% for days 1 through 20 in a benefit period. For days 21 through 100, Medicare typically covers all costs except for the required Medicare copayment. TRICARE for Life covers the copayment. After day 100, TRICARE for Life is primary payer for covered skilled nursing care, and the patient is responsible for the TRICARE for Life cost share. A new benefit period starts again with Medicare once the patient has not received any inpatient hospital or skilled nursing facility care for 60 consecutive days. A participation agreement is required. For a beneficiary who is both Medicare and TRICARE for Life eligible, TRICARE for Life can pay secondary for a skilled nursing facility that participates in Medicare and has entered into a participation agreement with TRICARE for Life. Upon exhaustion of Medicare benefits, TRICARE for Life may pay primary to such skilled nursing facilities. Skilled nursing facility providers are required to sign a Skilled Nursing Facility Prospective Payment System Agreement with TRICARE for Life in order to be considered an authorized TRICARE for Life provider. Claims for skilled nursing facilities that do not have this agreement on file will be denied. There are specific bill types and HIPS codes that are necessary to process skilled nursing facility claims. TRICARE for Life has adopted Medicare's Skilled Nursing Facility Prospective Payment System payment methods and reimbursement rates, consolidated billing requirements, and minimum data set or MDS assessment requirements effective with all skilled nursing facility admissions occurring on or after August 1st, 2003. In addition to the 0022 revenue code and corresponding HIPS code, all skilled nursing facility claims must contain a line item listing by revenue code of all services rendered to the skilled nursing facility inpatient resident during the dates of service on the claim, and the billed amount for each. This line item listing should include a room rate charge, revenue codes 10X, 11X, 12X, etc. for the number of bed days equal to the date span of services billed. Leave of absence or transfer to acute care. Any leave of absence bed days must be billed with the applicable 18X revenue code. If a skilled nursing facility resident returns to the facility following a temporary absence due to hospitalization or therapeutic leave, it will be considered a readmission and any leave of absence days will be disallowed. As under Medicare, neither TRICARE for Life nor the patient are responsible for any charges related to the leave of absence days. Skilled nursing facilities are responsible for performing the resident assessment every 30 days after the 90th day using the MDS assessment form for determining the medical necessity of services. Skilled nursing facilities shall use the default HIPS rate code of AAA00 on the claim in the case of an off-schedule or late patient assessment, or in the case of no patient assessment at all. Signature requirements. UB04 claim forms submitted with the corresponding Medicare EOBs do not require a signature by the facility's authorized representative. However, once Medicare benefits have been exhausted and if no Medicare EOB is attached to the claim form, an authorized representative must sign the claim form in or around Form Locator 80. A computer-generated name, stamped signature, handwritten signature, or initials are acceptable. Occurrence code A3 and the date of exhaust can only be accepted on the electronic crossover claim from Medicare. Other acceptable forms of documentation of either the Medicare or the secondary OHI's exhaustion date are an EOB showing exhaustion, or correspondence from CMS or the secondary OHI plan. Information from the Medicare A online system can also be used. Common claim return or denial reasons include missing or invalid or incomplete information on the claim form. This includes missing type of bill code, Form Locator 4, admission date, Form Locator 12, discharge status, Form Locator 17, occurrence codes and dates, Form Locators 35 and 36, revenue code 0022, and no accompanying 5-digit HIPS code, revenue code 0022 with a billed amount but no line item listing of all services rendered in Form Locators 42 through 47, or missing diagnosis codes in Form Locators 66 through 69. No Medicare or Medicare Supplement explanation of benefits showing payment or reason for denial or definitions of denial codes. No documentation of Medicare exhaust date. Illegible explanations of benefits or an unsigned claim form. Signature on file is not acceptable for provider signature. Missing or incomplete medical documentation or records. Or the date span billed and number of units for HIPS codes and room charges do not agree. TRICARE for Life requires pre-authorization for skilled nursing facility care once TRICARE for Life becomes primary payer. By law, TRICARE for Life is the last payer after all other insurance or benefit plans, including Medicare. Documentation of skilled care. TRICARE follows Medicare Part A guidelines for skilled care, excluding established feeding tubes or enteral feedings. To obtain skilled nursing facility prior authorization, please have the provider fill out the skilled nursing facility authorization form along with the following information: the most recent hospital history and physical, or H&P, current physician's orders, if admit or readmit, the physician admitting orders, and documentation of skilled care. We will complete your authorization request within 5 business days from the date of receipt. When an authorization is approved, the provider will receive a confirmation letter via fax. If the provider does not have a working fax, he or she will receive a secure email. It will also be mailed to the provider and beneficiary. 100% of all authorizations will be completed within 5 business days. Authorizations can vary depending on the patient's needs, but an authorization will only be granted for up to a maximum of 30 days. If additional care is needed beyond the 30-day limit, a new authorization will need to be requested. TRICARE for Life will never give an authorization to admit. TRICARE follows Medicare Part A guidelines for skilled care, excluding established feeding tubes or enteral feedings. Admit or transfer the resident and initiate skilled care immediately. Provide documentation of the skilled care the patient is actively receiving in your facility for an authorization. Do not delay initiating skilled care waiting for the authorization. What happens if I did not request an authorization? Can I get a retroactive authorization? Retroactive authorizations are not provided. If the service has been performed greater than 5 business days ago, the provider will need to submit a claim with supporting skilled care documentation for a review to the claim department via the website or via fax at 608-301-2114 or 608-301-3100. There is a payment reduction of 10% for not having an authorization. When skilled nursing care ends, visit the website and obtain a notice of non-coverage letter. Provide it to the resident or power of attorney for a signature and submit it with the request form as a cover sheet. How do I get a denial letter? Submit the TRICARE for Life Notice of Non-Coverage letter and you will receive instructions on what to submit to get the formal denial letter. Do I have appeal rights on unfavorable authorization determinations? Yes, you have formal appeal rights on denied authorizations, and those appeals are handled through the appeals department. The appeal request can be mailed or faxed to WPS SNF Appeals, 1707 West Broadway, Madison, Wisconsin 53713, fax number 608-301-3226. To submit an authorization, the most reliable way is to send the authorization request form specific to the request and all accompanying documentation by using TRICAREforyou.com. There is an easy-to-follow tutorial for providers if you go to Create a Provider Account and look at the top right of the page. Always use the authorization request form as a cover sheet. To send by mail, send all authorization requests and accompanying documentation to DIFIC MR Authorizations, 1707 West Broadway, P.O. Box 7934, Madison, Wisconsin 53713. Please note, sending to a physical address by any means is not recommended. The authorization nurses have up to 5 business days to complete a review, and they are done in the order in which they are received. The provider will receive a fax or a secure email if they do not have a fax. If there is no fax or email, the authorization letter will be mailed. We hope you enjoyed this tutorial on skilled nursing facilities. Please like us on Facebook, follow us on Twitter, and look for future tutorials from TRICARE for Life.